Registered professional nurse Alicia Dodds leads the palliative care service with healthcare workers at the Red Cross War Memorial Children's Hospital. She says her training has strengthened her ability to support both the patients and their families during immensely difficult times. Palliative care is provided when a patient has a life-ending disease or illness.
Palliative care in itself is the care of the patient, whether it be medical, whether it be physical, whether it be social, whether it be emotional. It's taking care of that patient, finding out what the patient's needs is, what the patient would want, what the patient desires, what we could do to make it better. Instead of just looking at the illness, we are actually looking at the patient and trying to make the days that that patient still has left as comfortable and as dignified as possible.
Most palliative services are offered by non-governmental organizations such as hospices. A focus on this kind of dedicated care for children has been lacking. There are many children who will succumb to their illnesses. Through this new framework, a proper care plan is outlined to provide the best possible assistance to patients and their families.
The framework is built on the 7 building blocks of the WHO Health Systems Framework, and in that 7 blocks there is very specific targets set and very specific procedures set out to ensure that the child is actually getting the best of support, the best of dignity and the pain-free treatment till the end of life.
10 years ago, the World Health Organization passed a resolution on palliative care. It called on all countries to strengthen this form of health service.
This is a very important development in palliative care, is to make sure that children and their families also have access to palliative care. So last year at the Red Cross War Memorial Children's Hospital, the palliative care for children framework was developed, and now we're working on making that much more accessible throughout the public healthcare system.
Experts say much work lies ahead to provide dignified palliative care for all, but supplying those who care for children with vital guidelines to better support the dying and their families is an act of love like no other. Mariska Botha, SABC News, Cape Town.